Hello, welcome back for today's session about similar strategic program with another drug type about chat chewing. I would like to directly move into the program. Strategic framework for controlling chat chewing and its growth in Africa. Strategic pillars are written in up to 12. One is policy and government, legal and regulatory framework, public awareness and education, school-based prevention, community mobilization, health service, agricultural diversification, economic development, law enforcement, research and innovation, monitoring and evaluation, and regional and international cooperation. The, con- the what you call the content is the strategic pillars, strategic objective, key activity, responsible body indicator, and the time framework. First, policy and governments. Objective, develop a comprehensive national chat control policy. Key activities, develop a national strategy, establish coordinating body, review laws. The institution can be parliament, office of prime minister, minister of health, and so on and so forth, and minister of agriculture, and the minister of trade, since it is a trade one. Key indicators are national policy approved, coordinated committee, establish the time frame, maybe 1 up to 2. Second, legal and regulatory framework, strength and regulatory of chat production, sale and consumption, key activity, licensing, age restriction, regulatory advertising, regulate advertising, restrict public consumption, institution, Ministry of Justice, policy, governments, and media. Indicator, number of licensed vendors, compliance rates, the time frame, short and medium time frame. Public awareness and education, increase public understanding of health, social, and economic impact. Key activity, mass media campaign, school education, community awareness, and religious institutions. Responsible bodies are Ministry of Health, Education, and Media. Indicators are public awareness level, number of campaign. The time frame is continuous. 4. School-based prevention. Key objective is prevent use initiation. Key activities are integrate drug education into curriculum, establish school clubs. Institution, Ministry of Education and Schools. Indicator, a reduction in students chat use, schools implementing program. The time frame is continuous. 5. Community mobilization. The objective is engage communities in prevention. Key activities are work with religious leaders, elders, women's, and youth groups. Responsible bodies, local governments, NGOs, faith-based organizations. Indicators, number of community program, participation rates. The time frame continues. 6. Health services, improve prevention and treatment services. Key activities are established counseling center, rehabilitation service, mental health supports, Ministry of Health and Hospital body. Indicator, number of treatment center, patient receive treatment. Time frame is medium up to medium, short and medium. Agricultural diversification. 7. Strategy to reduce dependence on chat production. Key activities promote coffee, fruits, vegetable, spice, cash crop, and provide subsidies. Ministry of Agriculture body. Indicator, percentage of farmers adopting alternative crops. And medium up to long range time can be used. Economic developments. Objective, increase alternative income opportunities. Activities are vocational training, SME financing, small and medium scale financing, enterprise financing, youth employment, body, Ministry of Labor, finance and private sector, indicator, employment rates, increment, number of business created, the time long term. 8. Law enforcement, reduce illegal production and trafficking is objective. And activities are border surveillance, inspection, anti-smuggling operation, body, police, customs and immigration, indicator, number of enforcement operations, reducing illegal trade. Time is continuous. Research and innovation supports evidence-based policy making is objective. Uh, Activities are national survey, health research, economic impact studies. Bodies are university research institutes. Indicator, annual research reports, national database established. The time is continuous. 11. Monitoring and evaluation, M&E. Objective is measure implementation and the impact. Activities, annual review, baseline survey, performance monitoring. The body, National Drug Control Agency, and also educational institutions and health sector. Indicators are annual progress reports and also indicating attachment. The time is annually per year. Regional and international cooperation is objective strengthening cross-border collaboration, activities, information sharing, harmonized regulation, and joint operations. The bodies, African Union, regional economic community, and national governments. Number of regional agreements is one of the indicator. Joint operation conducted and also continuous time of the framework. So this one is one of the mentionable activity. The matrix. What are the implementation matrix? Which has strategic goals, activities, outputs, outcome, and impact. So one is reduce chat consumption is a goal. Activities, awareness campaign, education, counseling. Outputs, increased knowledge. Outcome, reduced prevalence of chat sharing. The impact is improved public health, Protect use. Second, protect use. Activity is school prevention program, outputs, drug education in school, outcome, fewer use initiating, chat use. The impact is healthier future workforce. The strategic goal of improving healthcare. Activity expand treatment services, outputs, rehabilitation center established, outcome increased recovery rates, and the impact is reduced addiction burden. Diversify agriculture. The next goal, activity alternating crop supports, outputs, farmers producing diversified crop, outcome reduced depends on chat farming, the impact is substantial rural livelihood. Strengthen law enforcement. Activity is licensing, inspection, border control, outputs is better regulatory compliance, and outcome is reduced illegal trade, impact is improved public safety. Generates employment. Activities, entrepreneurship and vocational training, new business and job is output, and the outcome is increased household income. The last impact is reduced economic dependence on chats. Next, improved governance, activity, national coordination and policy implementation. The output, strong institution, outcome, better inter-agency collaboration. The impact is effective national drug control system. Lastly, strengthen research, activity, survey and policy study. Output is reliable national data. The outcome is evidence-based decision making, and the impact is more effective policy and the strategy. So based on this, we will have our best controllable issue, and monitoring and evaluation also can be have some indication about adult chat chewing prevalence, chat use, farmer adopting alternative groups, rehabilitation center established, public awareness campaign conducted, school implementation prevention program, licensed chat vendor combined with illegal chat trafficking case, national research study completed, and annual policy review completed. This one can be indicated. The baseline also be from the initial one. The target maybe have some of the percent, one another, 50, 80, 90, and so forth. So means of verification can be national health survey, school survey, agricultural report, Ministry of Health report, media ministry report, Ministry of Education, inspection report, policy custom university, and government report is one of the indicator. So the next time we will see how it can be a very serious risk on the nation. But right now, we know about the risk and the consequence. When you see about the Yemeni and what you call Somali, Sudani, Ethiopia, and what is that in Kenya, and so on and so forth. So this has a big prison addiction. So let's be strong, wake up, and do our best. Thank you very much. See you soon.